Welcome back to Micro Mayhem. Today we're diving into the interpretation of Qft-Plus test results. Let's start with the basics. How are Qft-Plus test results interpreted?
Well, proper assessment of patients suspected of TB infection takes into consideration a combination of epidemiological, historical, medical, and diagnostic findings, of which the QFT-Plus result is an essential component. Firstly, the optical density readings are provided numerically, and a value of 0.35 IU per ml and above it is defined as a positive result. A positive QFT-Plus results suggest that current Mycobacterium tuberculosis infection is likely. The result does not differentiate between recently acquired or old infection, or between latent TB and active tuberculosis. Secondly, a negative QFT-Plus result suggests that Mycobacterium tuberculosis infection is unlikely, but it cannot be excluded, especially when the illness is consistent with tuberculosis disease or the likelihood of progression to disease is increased, for example, due to immunosuppression. In rare cases, result can not be interpreted as blood cells have not responded to a positive control cytimulatant. This indicates the sample may have been mishandled, such as delay in sending samples or over or under fillings of the specimen tubes, or may be related to the immune system of the individual being tested. These results are called indeterminate. TB infection can neither be excluded nor confirmed, and repeat testing is recommended.
Great insights. So, how's the cutoff value of more than 0.35 IU per ml established?
Well, as expected for any diagnostic test, there is a trade-off between sensitivity and specificity. If one is increased under a different cutoff, then the other is decreased, and at the same time. A cutoff was selected that gives the best combination of sensitivity and specificity.
Why would I see false negative results in patients with active tuberculosis?
Oh, interesting question. Individuals who progress to active TB do so because their immune system cannot control their infection. This can result from a large infectious exposure to Mycobacterium tuberculosis or due to individuals having an impaired immune response. Typical for malnutrition individuals, those with advanced TB, or those who are severely immunosuppressed or those immune function has altered. So, some individuals may develop active TB due to a genetic deficiency in their immune system, such as inability to produce sufficient interferon gamma and or interleukin 12. Others may develop active TB as a result of iatrogenic immune suppression, for example, individuals taking anti-TNF gamma medications. Secondly, it is important to note that QFT-Plus is a test for Mycobacterium tuberculosis infection and is approved as a diagnostic aid for indirect detection of Mycobacterium tuberculosis infection, whether active TB disease or latent TB. Doctors may use QFT-Plus to assist in the diagnosis of active TB in conjunction with risk assessments, radiography, and other medical and diagnostic evaluations. A negative QFT-Plus result is in a person with obvious symptoms of active TB should no means be used to rule out active disease. Culture of Mycobacterium tuberculosis remain the gold standard for confirming a diagnosis of active TB.
What should I do if the QFT-Plus result is indeterminate?
Well, when the result is indeterminate, when represented with an indeterminate result, physicians may choose to redraw a specimen or perform other procedures as appropriate. However, an indeterminate QFT-Plus result in meaningful suggestions possible error in performing the test or immunosuppression, particularly in patients with known or suspected immunosuppression, chronic disease, malnutrition, or no medication known to decrease immunity. By including an internal positive control, which is the Mitogen tube, QFT-Plus is better at distinguishing between indeterminate results in those prone to immunosuppression and those that are QFT-Plus negative. Mitogen is a substance that stimulates cell division and immune cell activation, which play a key role in immune response. When added to the patient's blood sample, it should trigger a strong immune response if the immune cells are functioning properly. The result from Mitogen tube is compared to the nil tube, which contain no stimulant, to confirm that the immune cells are capable of producing interferon gamma, an indicator of immune activation. If Mitogen tube shows a strong response, but the TB-specific tube do not, it suggests that the immune system is capable of responding, but there is no TB infection. Conversely, if there is no response in the Mitogen tube, it may indicate an issue with the patient's immune cells, which could lead to indeterminate results.
What is the meaning of Mitogen negative responses in healthy individuals?
Well, in a very small proportion of individuals, indeterminate QFT results may be obtained despite the subject being apparently healthy and immune component. In most instances, repeating of QFT-Plus test with a new blood sample will result in a non-indeterminate QFT results, suggesting that the initial result may have been due to technical response, such as under-shaking or overfilling the Mitogen tube. However, for a very small proportion of subjects, the repeat test may also be indeterminate. These rare cases, the reason for the indeterminate result is unclear if immunosuppression and technical error are ruled out. Such a response may be transient, and retesting the individual after several weeks may result in non-indeterminate test result.
Is a patient with positive QFT-Plus response contagious?
The QFT-Plus test is both a test for latent TB and can be a helpful aid for diagnosis of Mycobacterium tuberculosis disease. However, the result should never be used to determine contagions or active disease. When a positive result is obtained, a chest X-ray and medical evaluation are necessary to determine whether contagious disease is present. Microbiological tests should be ordered if the evaluation suggests active TB, a contagious conditions. In contrast, if the chest X-ray is normal and the medical evaluation is unremarkable, the patient likely has latent TB and asymptomatic and non-contagious state of TB infections.
Can the level of positive QFT-Plus results be used to give an indication of the likelihood of active disease in the future?
Well, that's an interesting question. QFT-Plus is a qualitative, not quantitative test of TB infection. With current knowledge from QFT, a higher magnitude of interferon gamma response has correlated with the higher rates of disease progression. QFT-Plus research studies are underway to examine the correlation of the disease progression with the CD8 interferon gamma response, which is TB TB tube 2 and TB tube 1, as well as overall quantitative values.
Does a positive QFT-Plus result become negative after treatment, for example with isoniazid therapy? And if so, how quickly does this occur?
Well, in period study using QFT gold in tube, which is the old assay, among individuals who have had isoniazid therapy for latent TB, data suggests that response decline with time, but still remain above the test cutoff for a higher proportion of individuals. Thus, the current level of evidence does not support using QFT-Plus for monitoring the response to treatment of those with latent TB. In individuals who are given multi-drug therapy for active TB, a drop in QFT response or a change to a negative result with treatment is often observed. However, it is currently not known if this has any association with the clearance of the Mycobacterium tuberculosis or the prognosis of the patient. A small QFT-Plus study undertaken in Japan among active pulmonary patients showed that the CD8 response, of which is found in tube 2, continues to decline throughout treatment, whereas the CD4 response decline initially, but not significantly after 3 months. However, more evidence for sure it's needed, and not all patients with active TB have a significant higher CD8 response initially.
What does a positive QFT-Plus result mean in patients treated for active diseases a long time ago?
Well, a positive QFT-Plus result in someone with prior treatment for TB disease may be due to a variety of reasons. It could simply represent a memory response, continued presence of Mycobacterium tuberculosis infection, or reinfection. It is unclear at this time whether the presence of a higher CD8 response will help in satisfying the patient's risk of the future disease. However, QFT-Plus does not differentiate active disease from latent disease, as I mentioned, and may even remain positive for a considerable period of time in individuals who have a clinical response to treatment. Overall, individuals who have been treated for active TB a long time ago and now tested positive by QFT may have been reinfected or may still carry their old infection and should be clinically evaluated for active TB.
Should I expect the TB2 tube quantitative value to always be higher than the TB1 response? Can you explain why the TB1 response may be higher on occasion?
Well, the TB2 tube antigen of QFT-Plus has additionally peptides optimized for stimulated CD8 specific for TB compared to TB1 tube that contain only CD4 optimized antigen. As I mentioned in my first episode, this point, although one might expect a consistently larger response from TB2 because there are more antigens, this is not necessarily the case because the CD8 response should be self-limited in TB immune response, and CD8 T cell effector cell function should be more readily detected when intracellular TB burden is higher.